Hello everybody, this is Margareta Harris in WHO Headquarters Geneva, welcoming you to our global press conference on
so that transmission can no longer take place, or it's very difficult for a virus or a pathogen to transmit between people. So that's the concept of that. One of the things, if we think about herd immunity in a natural sense of just letting a virus run, it's very dangerous because you would need a lot of people to be infected. And there are estimates of what percentage of the population needs to be infected. But that means that many people are infected, many people will need hospitalizations, and many people will die. So what we're working towards in the vaccine, and there's colleagues here who can supplement this, is that to have a safe and effective vaccine that could provide protection to a large proportion of the population so the virus doesn't have an opportunity to transmit. But trying to reach herd immunity naturally would be very dangerous because a lot of people would die.
I'm just looking in the room to see if anybody else would like to contribute. And Soumya. Soumya, you online? Would you like to add something to that?
I think Maria's exactly explained, why it's important to think about population immunity with respect to a vaccine, because there really hasn't been any infectious disease that has been controlled just by allowing natural immunity to happen. So apart from the fact that it would take a very long time, because we've seen from all the sero surveys around the world that on average 5 to 10% of people have antibodies, which means that they've exposed to the virus and they've recovered from it. In some cities, it has been found to be higher, but on the average, majority of the world's population currently is still susceptible to this virus, which means that the infection can go on and on and on in waves. And so the best way to achieve that kind of population immunity would be through a vaccine. And Maria also mentioned that what percentage of the population would need to have protective immunity is something that we are still trying to understand. But in general, the more transmissible the virus, the higher the proportion of people that would need to be immune. So if you take a virus like the measles virus, where one person can transmit to 15 to 20 people, you need 95% of that population to have protective immunity through a vaccine in general. In the case of SARS-CoV-2, we know that one infected person could potentially transmit to 2 to 3, or could be even more people given the setting. If it's a crowded setting, it could be one person transmitting to more than 3 or 4 people. You would need probably about 65 to 70, in that range, percent of the population to have protective immunity. So to get to that level across the world and across all populations, urban and rural and age groups, one can do it most safely and efficiently through a vaccine. Thanks.
Thank you, Dr. Soumya Swaminathan, our Chief Scientist. So the next question, we will be going to Adam Vaughan from New Scientist. Adam, can you unmute yourself and ask your question?
Hi, thanks for giving me the chance to ask a question. It was just related to the question earlier on about face masks in Paris. I wanted to ask, are the responses that we've seen this week by European governments to growing cases, are they commensurate with controlling the virus in the region? I'm thinking of things like the face masks in Paris, Germany reportedly planning to limit numbers at private parties and so on. I appreciate you don't want to get into rating individual governments, but I wondered if you could talk about the region as a whole, whether the sort of measures we're seeing are sufficient.
Thank you very much. Yes, I mean, I think what we are seeing and what we are learning from countries and what countries are doing is that they are taking this data-driven approach. They are looking at the situation in their country, across their country, looking at it at a low subnational level, the lowest administrative level as possible, and seeing what are the tools that I have that can help break these chains of transmission, that could prevent small numbers of cases becoming clusters, clusters of cases becoming community transmission again. And what we are seeing are countries applying different measures. And again, I just want to highlight that what we are seeing are targeted approaches, tailored approaches to the need, and hopefully these are time-bound, that these are limited to where they need to be, when they need to be implemented. You mentioned the use of masks in certain settings, mentioned the use of limiting the size of gatherings. I think all of these are different tools that may need to be applied. And I think what we're seeing is this calibration of putting in efforts to suppress transmission, to keep it at a low level, while allowing societies to open up. I mean, this is one of the critical things that we are all trying to figure out now. How do we use the tools that we have now to keep transmission low while getting people back to this quote-unquote new normal and what this looks like? How do we open up our society safely? We resume activities, but we keep transmission low. And I think this calibration of applying some in a time-bound and a targeted and a tailored way is the right approach. We will see, and countries will see. Again, we need to support governments, we need to support countries, we need to support communities, we need to support individuals in the application and the adjustment of these. We will go through some changes, and being able to communicate this in a clear way so that everybody understands what they need to do as individuals, in families, in communities, and at a national level is really, really critical going forward. So I think we're in an adjustment period, but we're using the tools that we have. And this is really important. We have tools that we can use, and governments are using them.
Thank you very much, Dr. Van Kerkhove. I see no other interventions in the room. So for our next question, we go to Theo Golden from Bloomberg. Theo, could you unmute yourself and ask your question?
Hi there, thank you so much for making time for me. A study published this week in the Nature Research Journal showed the different T-cell responses